Hey, how's it shine there, my friends? Dr. Allen here, and today we're going to be talking about something honestly pretty scary in the eye care world, and that's the recent FDA recall of many different eye drops, which have sadly even been linked to people going blind and even some reported cases of death. Now, unfortunately, there have been several recalls by the FDA for various contaminated eye drops throughout 2023. And we just recently had another on October 27th, which includes eye drops that are often sold at CVS, Target, and Rite Aid stores. So in today's video, we're going to review which eye drops were on that recent recall list so that you can be on alert. Plus, we'll share some additional tips and resources that'll help you verify any eye drops that you may be in question if you're going to purchase them, so that you know if they've been recalled by the FDA or if you should be on alert about anything suspicious with that brand of eye drops. Plus, I'll share some of the tips I share with my own patients about how to better use their eye drops. Let's get into it. So first, just the other day on October 27th, the US FDA issued a warning to consumers not to purchase or use 26 over-the-counter eye drop products due to the risk of possible infection. And these products are marketed under these following brands. This includes CVS Health, Leader, Rugby, Rite Aid, Target Up and Up, and Velocity Pharma. And now they just added a Walmart Equate product to this list as well, with the FDA recommending that consumers properly discard any of these products specifically listed on the FDA website. But as always, we will include a reference link in the description below so you can check out this article yourself. But sadly, it appears that these eye drop recalls are becoming more and more frequent this last year, with just back in May, the CDC reporting that 81 individuals had developed a serious drug-resistant infection of Pseudomonas aeruginosa, which just happens to be one of the worst types of eye infections that eye doctors will see in the eye clinic. And no, I'm not going to show what these infections really look like. If you want to see something truly terrifying, you can look those up yourself on Google Images. But yeah, that type of infection can eat through the eye within 24 hours. And yes, sadly, there are reported cases of people who have gone blind and supposedly even some deaths from these types of infections. However, I will say a death from this type of infection is extremely rare. However, there is this overwhelming growing amount of concern in the eye care profession about the use of sketchy and potentially counterfeit and fraudulent eye drops and eye drop medications that are frequently sold on places like online websites. In fact, just a few weeks ago at the American Academy of Optometry, I got to look at and hold some of these counterfeit or fraudulent different medications and eye drops. It turns out we live in a really scary world where some companies are purposefully even copying different logos and colors and even trying to make a fake fraudulent medication look like the real thing. If you happen to have any of these eye drops on the FDA recall list, first, don't use them, and second, dispose of them properly. There are kind of recommendations by the FDA of how to properly dispose of them, and I will have that FDA site in the link in the description below. Now, other than just checking out the FDA website, another great resource that I recommend you look at going forward is eyedropsafety.org. This is funded by the Dry Eye Foundation, but works as a search engine. So if you find an eye drop that you're just not sure of, maybe you want to double check to see if the FDA did a recall or a warning on this, you can check out that search engine, you can type it in, and it'll tell you if a recall has been issued, if there's any weird ingredients that maybe haven't been approved by the FDA. So this is a great resource, I think, going forward if you're thinking about purchasing an eye drop, especially anything online. But could also be useful if you're at a local store and you just want to double check to make sure what you're purchasing has not been already recalled. Okay, now, of course, if you have been using any of these eye drops and you suspect you may have an infection, definitely encourage you to contact an eye care specialist in your area right away. I do encourage you that whether you have an infection because you think of the eye drops or any type of infection of the eye, I do encourage you to contact an optometrist or an ophthalmologist in your area who has experience with eye infections, as we have the knowledge and training to do a swab of the eye to run that to see exactly what type of bacteria or microorganism it could be. We also have the training and knowledge of all the minutiae differences of all the different eye drop medications to manage infections. Otherwise, if you happen to live in an area where you don't have direct access to an eye care specialist specifically, then of course contacting a local urgent care clinic, your family doctor, or even the ER in emergency cases. Now lastly, I just want to share some pro tips on how to safely use your eye drops so there's less chance of your eye drops getting contaminated. First of which is to wash your hands with soap and water before and after using any eye drops, right? Because bacteria and microorganisms can live on the bottle themselves. Second is to avoid touching the tip to your eyelashes, the skin, or the eyeball itself, as that could cause bacteria to contaminate the bottle. And then of course avoid using any eye drops that have either expired or have been open for longer than 30 days. Also, it's best not to share eye drops with anybody else. If you are someone who in the past has touched the eyedropper to your eye to verify that you've gotten the drops in there, one extra tip that has seemed to work for a lot of my patients is that they put the eye drops in the fridge, because then when you get them in the eye, it's like a cooling effect and you know that the eye drops have in fact gotten in. Also, the cooling effect can have a soothing sensation to the eye, and the nerves on the eye happen to be more sensitive to cold, and you'll even produce more tears because of it. And statistically, about 70% of people do end up touching the tip of the dropper to their eyelids or their eyelashes in some fashion. So this last year, I just learned about this product called Magic Touch, which is kind of like a medical-grade silicone fingertip topper that you can then place the eye drop in the small well at the top, and then while holding it vertically, you can kind of touch it gently to the edge of your eyelid. If you think this might be something that would help you, then it may be definitely something to check out, as it can be washed and it's made of a type of material that is naturally antimicrobial. Hey, thanks for watching, and I hope that you found this video helpful and informative. Please let me know in the comments if you have ran into any of these recalled eye drops that have occurred any time throughout here in 2023. And if you've seen any kind of sketchy, possible fraudulent eye drops, definitely let the dropsafety.org know, because you can notify them of something that you find suspicious. Also, let us know in the comments if there's something you think people should be aware of. Otherwise, if you haven't seen my other videos or guides on how to properly put in eye drops or other tips to help your eye drops work better, then I'll put those over here to the side. Otherwise, hope you're having a great one. Keep an eye on it, and we'll see you in the next one. Adios.